Hello everyone, it's Instructor Howard, and we are wrapping up BC 2011, and then we will cover what's next after this course is completed. I also have a few coding examples from your Week 5 coding exam and your Week 4 assignment. So what this video covers, once again, we are wrapping up Week 5, and we're pretty much looking back at what we learned from Week 4, reflecting on prior lessons. We're going to cover basic coding strategies, for example, using keywords and main terms. This is something that you should be very familiar with, but at this point I just want to make sure that you guys can assure that you're doing your coding accurately. We're going to look at some of those examples. We also have some sample coding for Week 5 coding exam. We're going to completely solve case 1. And we're going to look at Week 5 assignment and some coding scenarios, reviewing that, as well as some coding scenarios for Week 4. And then what's next? The next course is BC 2020, and I'm going to cover what you guys are going to learn in that course and the books. And then finally, farewell, because this course is ending in a couple of days, and I just want to make sure that everyone is on the same page and is in perfect alignment for passing this course with a 70% or better, and then moving on to your next coding class. Okay, so we are wrapping up Week 5 once again, and have you completed Week 4? I know that every week I send out some little email asking you, have you completed Week 4? In Week 4, you should have completed your one step-by-step assignment, one keyboarding assignment, and this is extremely easy. These keyboarding assignments are basically free points because you're really not losing any points unless you're not submitting it. Your module, you have one module that you should have completed in Week 4. If not, complete it as soon as possible. You have your Week 4 coding exam, one regular test, and never forget to complete your extra credit. In Week 5, by Sunday midnight of this week, you will have need to completed your step-by-step assignment, another free 36-point keyboarding assignment. Week 5, you'll have 2 modules, one coding exam, one regular test, and extra credit. Make sure you have your checklist together just so that you can assure that you have submitted everything that you need to submit. Look at or pay attention to your points, your total points. You want to aim for at least 695 points in this course to put you on target for 70% or better. So here are some basic coding strategies. Remember, you're always dealing with diagnosis coding. You're always going to pay attention to your main term or your key terms in the scenario. It does not matter how long your scenario is. You're just going to go through and look for these specific words so that you can pinpoint and abstract what should be the diagnosis or the ICD-10 coding for today's visit. That's all you have to do. So as you can see, I have these particular words, and I call them action words, or words that can happen to any organ system or any body part. Disease, syndrome, history, burn. You can have a history which could be personal or family, and your book is divided in that manner, and you have had some scenarios that you had to look up like that. Burn, you can have a burn anywhere on the body. You have different types of burns, you have different degrees of burns. So the main problem is a burn. The same thing with the neoplasm. It may be known as a tumor, a lesion, or a cancer. Pregnancy. It's not necessarily a disease, but it's a condition. So these are conditions influencing the health factor. The patient needs to come in to assure that the pregnancy is normal, or that there's a complication in the pregnancy. And now we're not going to be coding for specific problems like anemia or disease. We're going to be coding it primarily as a pregnancy or this problem complicating a pregnancy. We also have pain. You can have pain anywhere. You can have a headache, a head pain, teeth pain, abdominal pain, back pain. So you want to make sure that pain is your main term. These specific words like anemia, asthma, it's a disease in itself. So you start with anemia. There's various types of anemia. The same thing with asthma, and that's not listed here. Infection. You can have a tooth infection, respiratory infection. You can have a kidney infection, liver infection, bladder infection. Your main term, infection. The same thing with fracture, abnormal, hypertension. So as long as you know to pull out these specific key terms, when you're dealing with diagnosis coding, it doesn't matter how many codes you're going to abstract, how many cases you're going to code. You're just going to know that these are the words that you're looking for in the alphabetic index. Okay, so now that we've covered that, we are going to move on to week 5 coding example. This is a case that you have on your week 5 coding exam. As you can see, we have a full scenario. We're talking about Douglas. He's 6 years old. His mother reported early problems with speech production, hyperactivity, aggressive outbursts, behavioral problems, hand biting. But as you can see here, we stop all of that. Those are signs and symptoms or evidence of a more specific problem. We have a physical examination. So on the physical examination, the pediatrician notes that Douglas has a slightly longer face, longer ears, more prominent jaw than would be expected for a boy his age, but nothing too unusual. So then he did a molecular analysis which revealed Fragile X syndrome. We have all of this information here, but since we have a confirmed diagnosis that it has been revealed through testing, we are definitely going to omit coding any of this other information. We're just going to deal with Fragile X syndrome. And even though it's written as Fragile X syndrome, your main term once again is syndrome. So that's where we began in the index. So let's code this example, and we're going to see how easy this scenario is and how much of this information was irrelevant, and that you will continue to process your cases in the same manner because it's really simple. So here I have my electronic ICD-10 manual. This side over here represents my alphabetic index, and this side over here represents the tabular list. So I start with my search phrase of syndrome, and I do an index search, or I just search for the word. I have various types of syndromes. As you can see, my little parenthetical notes here is explaining that this could also be coded to disease. But we're going to continue with the word syndrome. As you can see, this is exactly how your ICD-10 manual is list or itemize the wording underneath the word syndrome. It starts with the numericals, and then it goes into alphabetic. You see abdominal acute, muscle. So now that we're in the A's, we're going to try to locate the F's so that we can pull the Fragile X. And so I'm going to continue to scroll, and for you, you will probably be going several pages over from the word syndrome alphabetically until you get to your F's. And then as you can see, the words are indented. This is first level indentation. And then first level indentation, you have second level of indentation. So don't confuse your F's under second level of indentation. You want fragile or Fragile X to be in the first level of indentation, which is the word that sits out almost by itself. Okay, I'm in the F's. I see fatigue. I see fetal. I gotta keep going over to the R's. There it is, Fragile X. So first level of indentation. There's nothing underneath. There's no additional subterms. It's giving me my reference code of Q99.2. I'm going to take this code and review it here in the tabular list. I have some instructional notes here that I want to pay attention to, but for now I am going to begin with my 3-digit category of Q99. It tells me that this is other chromosome abnormalities not elsewhere classified. You can have a chimera, which is a Q99.0, and if you really want to know what these particular diseases are that you're coding so that you can get more familiar with what's going on and further into the treatments that they do for them, you can always research, because one thing as a coder, we are some excellent researchers. For example, the Q99.0 chimera 46XX46XY. This is a problem with the chromosomes where twins, sometimes a boy and a girl, will fuse together and create one person. And as you can see here, the little inclusion notes under here says this is a hermaphrodite. So this is a syndrome or a problem, a chromosome issue that happens when people's fraternal twins fuse together, and it could be a boy and a girl. So as you can see, XY and XX. For girls, we have an X and a Y chromosome. I'm sorry. For girls, we have 2 X chromosomes. For boys, they have an X and a Y. So that's the difference. And so we're going to move down, and that's just a little sidebar note that you guys can just do your research and try to figure out what it is you're coding, so that the when we get into CPT coding or procedure coding, the procedures make sense. Okay, so we have Q99.2, and it's telling me Fragile X chromosome or Fragile X syndrome. It's included in this note. So even though it's mentioning here that we're talking about chromosome, underneath in our inclusion notes, it also codes to Fragile X syndrome. And then if you want to look up some, for me, I have the option to look up some referential information. But if I didn't have that, I could probably Google. You have your instructional notes that are inside of your ICD-10 manual. So you don't want to just code. You want to code and take notes. And you can also jot down notes inside of your ICD-10 manual next to your coding. Highlight it. Get familiar with your book so that if you have to code that scenario again, you know exactly where to come back to or what's in there. Okay, so moving on, we have some week 4 assignment scenarios. These are some questions that have been pulled from your workbook in chapter 6. Remember, every other question has been answered in the back of your workbook. That's why you're only given the even numbers. You can take the odd numbers and review them on your own and see how these particular scenarios or cases were answered. Okay, so the first thing we have in number 12, and I'm just going to review 3 of them just so you guys can be assured that you were on the correct path. If you were not, then you should definitely, if you have not submitted it, then you should definitely submit it. If you didn't do well, then this is just something as a learning experience for you. So week 4 assignment. Now, question number 12 says abscess of the salivary glands. And the main term, and I bet you guys have gotten this correct by now, is abscess. So you go alphabetically to the word abscess. You're going to have first level of indentions of different types of abscesses or body parts. Alphabetically, go down to the S's, and you'll see salivary, and then you'll see parentheses duct or gland, and you'll be taken to a reference code that begins with a K. Always begin with a 3-digit category and then pick your code that is closest to or resembles your scenario the best. 14. Chronic prostatitis with hematuria. So first thing we have to deal with is the prostatitis, because it's inflammation of the prostate gland. The type is chronic. It could be chronic or acute or something else, but we're going to deal with prostatitis. That's the first thing you should have went to, and then underneath you should see the different types. You want to go down to chronic. you're going to be taken to a code that begins with an N, cross-reference that, and then you will code separately hematuria. If the word hematuria was included with the code for prostatitis, then we would not need to code two diagnoses. But since there isn't any mention of blood in the urine with this code, then we have to code the hematuria separately. And the only thing you would do is go to the H's and look up hematuria, and you would be given a reference code that begins with an R, cross-reference that. So 14 should have two codes. 16, you have stiffness of the wrist, of the right wrist. Now, stiffness is your main term. We need to pay attention to what a wrist is in order to locate the correct code. Your wrist, or any area of your body that bends and circulates and flexes back and forth, that's considered a joint. So you would go to the word stiffness and then joint, and then from joint you would go down to or next to and find the word wrist, and you'll be taken to an M code. It's a long code, but you want to make sure you code it accurately. Begin with a 3-digit category in the tabular and pull your code, and that's pretty simple. That's exactly what you do over and over again. You have a lot of scenarios and a lot of questions to answer in these examples, but that's pretty much how coding works in real life. So you know, we're just trying to get you used to breaking down these cases and looking at them and assuring that you can answer or code almost any type of scenario with little or no error. Okay, so I have pulled week 5 assignments, some scenarios from week 5, but what I'm going to do, because I don't want to do the true and false, I want to actually look at some coding scenarios. So what I'm going to do is I'm going to begin with, I guess, number 26. So let me pull the worksheet over. Okay, so here we are, beginning with number 26. We have induced abortion complicated by endometritis. Okay, that looks like a long one, but we pretty much have one code. The word that we began with is abortion because the patient lost the baby. So you would start with, I'm just going to type over here. That's where you begin in the alpha index. The type of abortion is induced. It could be, you know, a medical abortion, but it's induced, which means the body caused the woman to have expel the baby from the uterus by, you know, complications. And then from there, first level of indention is induced. Second level of indention should be complicated. And then we may even have third level of indention. And so from there, and every code everything that's focused on pregnancy starts with a 0. So you have a 3-digit category. So let me see how this would actually code. Okay, because pregnancy and dealing with abortions and miscarriages and things like that are very complicated, I'm going to go through this scenario with you guys. So we have abortion complete spontaneous, and that's what we began with. Our 3-digit category is 0039, but since we have more details, like it's induced, we want to see if we can find our first level of indention. We're going to bypass attempted, and we're going to go further down to the eyes. We're going to bypass complicated, even though that's in our scenario. We want to get to the first level of indention for induce. We have incomplete, induced. Okay. Now, we have induced, but we have more details. So the second level of indention under induced is complicated by. The third level of indention under complicated by. Let's find what complicated this. Endometritis. So that's where we are, and it gives us a different reference code with a different 3-digit category than where we began. So now we're going to search for that in the alpha index 004.5, and then we're going to see that this is just the 4-digit categories, 3 and 4-digit categories. We have 004 for the 3-digit category, 004.5 for the 4-digit category, and then we're going to go a little further right here, and we're going to look at what all this includes, and these are our inclusion notes. So it includes genital tract and pelvic infection following induced termination of pregnancy, and that's pretty much it. We have this 3-digit category, but we can code to this one because the 5 represents the full complication or the full description. We have endometritis here, we have termination of pregnancy up here, and this code includes this information, and that's pretty much what you have to do. As you can see, I went 4 levels of indentation underneath the word abortion. I had to bypass words like complicated by or endometritis or failed because I needed to go to the type of abortion, which was induced. And that's pretty much what you do every time. You kind of bypass a lot of the irrelevant codes so that you can make sure that you're always on the same track, on the right track. Okay, so I am going to review number 32. This one seems like it's maybe a little complicated simply because it's a thicker or a lot more information in the scenario. 32, and let me enlarge my screen. Initial encounter of a patient transported to emergency department. Patient died from cardiac arrest due to an accidental overdose from heroin abuse. Okay, first and foremost, what happened to the patient? We see that the patient has cardiac arrest, patient died. So we're going to highlight some information in here. Cardiac arrest, red. And then we're going to say accidental overdose, which is not spelled properly. Accidental overdose. And then we're going to see heron. That's another main term. Initial encounter. So we're going to deal with table of drugs and chemicals, and we're also going to deal with external cause of injury. Okay, table of drugs and chemicals. We go down to the word substance. Okay, and then we will go from substance, table of drugs and chemicals. Let's go to substance. And the substance or the type is heron. And then as you can see, we have several columns. So we're going to code from the poisoning column. And then from poisoning, the type of poisoning is accidental or unintentional. And you'll be given a code for that. Basically, you know, abuse, drug, opioid with other opioid-induced disorder. Okay, so you should have the code for that. Let me see. Accidental. And let me look at this one on the... Okay, let's do table of drugs and chemicals. I'm going to go to substance. Okay, substance. I'm not seeing heron. Let me go to H-E-R-O-I-N. Maybe not that. Okay, heron. The substance column anything is a substance. So it represents heron. So we go alphabetically to the word heron, and we see accidental, unintentional. That's your first column. It's under poisoning. So we're not going to code for adverse effect. We're going to code for the accidental, unintentional. And here's your code that you would reference in the tabular list. And pretty much what we would look for is, let me see, poisoning by heron, accidental, unintentional. Now this is the correct code, but we need a 7th digit character. So as we can see in the scenario, it tells us that this is the initial encounter. First time the patient is being seen, your initial encounter would be an A at the end. Okay, so from there, that's our first code. From there, the patient, we know that the patient abuses drugs. So we can go to abuse, not alcohol, go down to the D's, drug, right here, NEC, what type is it? You don't know if heron is an opioid. That's why I said it's an opioid. Sometimes you have to look up what type of drug it is. There it is, opioid. And let me see, opioid. And then we can pretty much have, it has another disorder. Opioid abuse uncomplicated. Well, it's not uncomplicated because the patient died. So F11 is the 3-digit category. Opioid dependence. Opioid dependence uncomplicated. It's more than complication. We're not going to say with intoxication. Let's go back. F11.2. Let's go back up. F11.1. Here we are. F11.14, opioid abuse with opioid-induced mood disorder. It's beyond mood disorder. It's beyond psychotic disorder. Opioid abuse with other opioid-induced disorder. Okay, this seems like it better fits simply because the patient died. So we're going to do opioid abuse with other opioid-induced disorder. This is these are other. We need a 7th character, so that's why the F11.18 cannot be coded. We need to code to the highest level of specificity. So that's the second code. Now, what happened to the patient? We always have to code the manifestation. So what happened? He had cardiac arrest. So we go to the word arrest. The first thing we see is cardiac, and it could be due to a specific condition. So we're going to do due to. Let's look down here, because it was due to him having an overdose, taking drugs. Let's see, due to, that's cardiac condition, specified condition. Okay. Cardiac arrest due to underlying cardiac condition. No, it does not say he has an underlying cardiac condition, but it does say due to underlying condition, because he had cardiac arrest due to being poisoned, due to overdosing on drugs. And that's pretty much how we figure out what's next. Okay, so now that we've covered everything that you guys should have picked up pretty much throughout the entire course, wrapping up week 4 and week 5, getting you prepared to pass this course and move on to your next, we're going to see what is next, BC 2020. So this course introduces basic coding principles of procedure coding utilizing the Healthcare Common Procedure Coding System, which is HCPCS. The application of procedural coding principles of HCPCS Level 1, which are CPTs. So all procedure coding is categorized as HCPCS. You're going to learn about Level 1 and Level 2. Level 1 are the CPTs, and you're going to see an example of the books in a minute. Level 2 are Medicare National Codes for the purpose of reporting medical, surgical, and diagnostic services to healthcare payers for reimbursement. So you're going to be coding of surgical procedures. You're going to have some discussions about that. You're going to review the specialties, anatomy, medical terminology, reviewing documentation of other topics related to coding surgical procedures. You're going to be dealing with rejected claims and its process, how to get these claims appealed, extensive review and discussions of various policies in place such as time limits, appeals, billing and coding application, and you're going to have some practice, of course. And CPT coding, I think a lot of people believe that it's a lot easier than diagnosis coding because it's fewer CPT codes than it is diagnosis. So some people choose that CPT is easier. Some people prefer diagnosis. Some people, like myself, like them both because I like a challenge. So you guys will be able to determine that when you take your next course. So with CPT coding, you're going to be using still your step-by-step, and you're going to have your CPT manual and your HCPCS Level 2. So this book right here is generally used to report surgical supplies, surgeries for Medicare and Medicaid patients only. You're going to have a table of drugs and chemicals in here related to injections. And over here you're going to be dealing with 6 sections of procedures that providers normally code from on a daily basis, starting with office visits and moving all the way through surgery, radiology, laboratory, and then the medicine section is kind of like a catch-all for every type of provider. Will be able to use coding from there. So thanks for reviewing. Thanks for viewing. If you have any problems, contact me with questions. Farewell. And we are wrapping up BC 2011. Thank you guys for watching. Have a great next 5-week term. Bye-bye.